Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place, the Board of Health meeting will be conducted via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the link on our webpage. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center's live stream. The public will be allowed to make comments if they wish to during the portion of the meeting designated for public comment by using the raise hand function. The chair will continue to give guidance and instruction as needed. Every effort will be made to ensure that the public can adequately access the proceedings via technological means. In the event we are unable to do so, despite our best efforts, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting.
Very good, thank you. So I guess the first thing to do is to consider the minutes from the last meeting. Do any of my colleagues have any comment to make about them or suggest any changes or amendments?
I just wanted to check to see if we lost Carol. I don't see her, but.
Oh, no, I'm here.
Okay, good. Okay.
I see her.
Okay. She wasn't showing up on my screen. Sorry.
Get a bigger screen.
Yes.
Oh, I thought that the meeting minutes from the meeting were fine. No changes.
All right. So do I hear a motion to accept the minutes as they have been so recorded?
Yep, I motion to accept the minutes as recorded.
And
I'll second that. Okay. All those in favor say aye, and please state your name.
I, Carol Ahern.
I, Shelley Reaver.
And I, Roger Christian. Very good, thank you. So we move on to the appointment of the animal inspectors. Do you need to say anything about any of these people, Jared?
Just briefly, we're voting to reappoint. All of these individuals are in these positions as of now. So we are asking to reappoint Dr. Carolyn Thorne as our veterinarian, Officer Paul Jolicoeur as our ACO, Jason Roberts as our animal inspector, and Laura Fiske as our barn inspector.
Do we have to make any formal vote on these people?
We do. You have to ask for a motion to vote to reappoint these folks.
Okay, so I will ask for a motion to reappoint these particular people.
I second it. Or I move to make the motion
All right,
of the appointed.
And I'll second it.
very good, thank you. So all of us that want to continue by saying aye, if you're in agreement,
I, Carol Ahern.
I, Shelley Reaver.
and I, Roger Christian. So having moved and accepted those people, may we move then on to Margaret's health report.
Good afternoon, everyone. Good to see everyone back again. We do have one active case of Campylobacter that we wanted to share, an illness that can cause some bloody diarrhea, pretty bad abdominal cramping, pain, high fevers, fatigue. The incidence is about 1.5 million in the United States every year, so fairly common. The onset would be about 2 to 5 days after an exposure, and typically that would be to undercooked poultry, improper handling of poultry, improper hand washing after handling your dog's waste products, contaminated water, or unpasteurized milk. The good news is that it is typically self-limiting, meaning that it goes away by itself without treatment. There are some people who do become quite ill, and antibiotics can sometimes need to be used. And the good news is there are antibiotics available, pretty common ones that work great. In terms of people who are most at risk, it's the same group of people that are always at risk. If you're over 65, if you're pregnant or immunocompromised, it puts you at higher risk, but certainly anybody in those categories we just talked about in terms of unpasteurized milk, improper handling. So how do you prevent it? Hand washing, hand washing, hand washing, using a different cutting board for your raw meat versus the other food at home. Washing your hands thoroughly after you pick up after your dog. Cooking your chicken to the fattest point in the meat to a temperature of about 165 degrees at least. And then the trivia question for you guys, should you clean your chicken or not before you cook it and prepare it? There was a big debate between Julia Child and Jacques Pepin. So what's your answer? Jared, you're our resident foodie.
I vote no.
The answer is no, you're not supposed to. And Jacques Pepin got the answer correct. Julia Child wanted you to clean your chicken. Jacques did not, and he was right. And the answer is because all that splashing can cause cross-contamination with the other food that does not need to be cleaned. And I do not follow that rule myself at home, so I need to get on the wagon. There you go. That's your public health and cultural history all in one.
Thank you. Once again, thank you for this great educational moment. I mean,
You're
it's
welcome.
good to bring us back to the basics.
That's right, and something non-COVID related before Jared jumps in.
Oh,
Thank you.
Thank you, Margaret.
You're welcome.
So, Jared, do you want to head on?
yes. All right. Thank you. So yeah, the first thing I'd like to have us discuss before I get into my COVID report would be we would like to ask the board to consider voting to extend the expiration dates of our existing food establishment permits by 3 months. Due to the ongoing pandemic, we feel like it would be appropriate to allow our operators a little bit of a buffer for their renewal. They're still contending with, COVID related restrictions and different issues regarding seating and gathering size limits. And, some of them are, in the process of securing loans and different funds that are available with the COVID relief aid. So, just giving them that little bit of a buffer of 3 months, we feel like would be a nice gesture on our part and would, show obviously our support of what they've been able to do during the pandemic while keeping us all nourished and, and satiated by keeping their doors open and keeping their employees and their patrons healthy.
So I so move that we vote to extend the expiration date of permits for our food establishments
By 3 months.
by 3 months.
I second it.
Any discussion? Hearing none, let's call the vote. All those in favor signify by saying aye and indicate your name, please.
I, Carol Ahern.
I, Shelley Reaver.
And I, Roger Christian.
Great.
Therefore,
Thank
we
you.
have completed that.
Thank you, everyone. All right. So let's move on to COVID report. A few things to touch on. First and foremost is how we're doing as a community. Obviously, like many others, Westwood is trending up in recent weeks for our cases of confirmed illness. The last report that came out from Mass DPH had Westwood at 44 new cases in the previous 14 days. And that was up from 37, which would have been the 14-day reporting window previously. So we are seeing an uptick, not yet as significant as what we saw during the winter surge, but still concerning. The cases of the sort of breakdown of the infected individuals, it's running roughly about half of people under the age of 19 during that reporting cycle, which obviously we've been discussing and working together with other towns and with our school department to say in our youth sports leagues to try to get a sense of the the spread amongst our school age group. They had been relatively safe from COVID during the initial lockdown, and then, the reopening and the hybrid school model. And now that things are trending back into more of what a normal school, week looks like, with their activities and with social events and things sort of starting to sporadically reappear on their calendars, they obviously are more exposed. So we're trying to see if this is related to either of the variants that are in Massachusetts. I don't think we can definitively confirm that as of yet, although, anecdotally, the reporting is that these illnesses are a little bit different than what people had seen previously, is that the spread is much more quickly moved from person to person, which was sort of counter what we had thought at the beginning, that we thought smaller lung capacity would indicate that there was less probability of transmission. But from child to child is a concern, but from adult to child, I think, is probably more concern, based on what we are seeing. So, we're reinforcing our guidance requirements, and we're asking for folks, when they do gather, that, they follow the protocols, they remain vigilant, they make sure that they're not attending, oversized gatherings. They are wearing their face coverings when they're supposed to. They are washing their hands. They are staying home when they're ill. If they are around someone who is, confirmed to have COVID, obviously there will be, questions about whether or not they need to quarantine, and we will handle that. But we're also asking for folks, if they're going to travel or be in situations that may lead to the rapid spread of COVID, that they self-monitor. And if they find out someone within their little group of, friends or in their sports teams, is COVID positive, that they self-isolate and get a test. That some of that may not be required, but it's also not a bad idea either, to try to limit the number of infected asymptomatic people that might be walking around. So, we're working on that. It's been a little bit of a struggle to try to communicate to all these different groups, that cases are on the rise within the youth cohort of the residents of the town. So we're still working with our messaging. We've ordered some new signs to go up around the different parks and playgrounds, which are reinforcing the message about masks and social distancing, which I feel like some people have, sort of just let sort of trail off and have sort of lost their energy to maintain consistent masking. We all have. Obviously, this has been going on for so long. In addition to our rising case count, our test positivity rate has also rose slightly. It's up to 2.3% positive. That's up from 1.94 the previous week. So that's indicating a higher level of positives with more testing. Indicates that the virus is spreading more efficiently in the community, and we have to always be on guard that our R value is not going to lead to doubling and sort of this free spread of the virus out of control in the community at large. So far, we've been able to isolate and quarantine, and try to limit the spread. But the challenge with this group, which we talked about earlier in the year, these groups, the contact list is extensive for these groups. Anyone 19 and under has a much larger list of close contacts and potential exposures than most average people who kind of just go from work to home to maybe an activity or a club here or there. So the number of folks that need to be contacted when a child turns positive is debilitatingly long. So the school side is working on this. Margaret and our part-time nurses are working on it. We're utilizing CTC as well to sort of take some of the burden off of everyone who's making these phone calls. But it is a challenge, and we're hopeful that some of these things will become a little bit easier to manage. Maybe technology can be utilized to alleviate some of this burden, but it takes a long time to get a hold of everyone, to let them know that they've been exposed and they need to go into quarantine. And the longer it takes to get a hold of someone, the more likelihood is that that person, if they do turn positive, can infect someone else. So it's definitely a race against time. We are doing our best, and the school side is doing a phenomenal job of staying on top of things. And they deserve a lot of credit for the sheer volume of children they've had to communicate with in the last week. And so as things move forward, obviously this week is school break. We'll see what next week brings, but hopefully we can utilize our vaccination effort to sort of limit the spread and sort of tamp it down. So, we're not going over these numbers into higher and higher levels. As of now, we finished March. We had 71 total cases in March. We have about a week left in April, about 8 days left, and we're already at 77 for the month. So we definitely are trending in the wrong direction, but it's a race against time in terms of vaccination. So hopefully we will be able to just keep moving that ball forward, and that the spread of the virus will be slower, at least in the short term. So other issues with COVID that were up as of Monday. Good news is all Massachusetts residents 16 and over are eligible to receive the vaccine. Just a reminder that only the Pfizer is approved as an emergency use for 16 and up. Everyone else has to get either the Moderna or the J&J when and if it becomes available again. So that was sort of the last piece. So if residents can make appointments using the Massachusetts vaccination website, or they can call 211 if they need assistance. The last thing, the J&J vaccine obviously was paused due to some concern over safety. I don't know yet the timeline that will be and what sort of additional restrictions will be put on that vaccine to allow it to resume. So I think they're being very careful with their review of it related to some of the clotting, blood clotting that was reported. So I get, that's sort of a wait and see for us. Since we are no longer vaccinating folks, it's not going to be an immediate impact on us here, but obviously members of the community have already received that shot. We're concerned, and we've spoken to a few of them, and other members of the community may still want and prefer the 1-dose vaccine. So hopefully the scientists and the medical people will complete their review thoroughly and be confident that that vaccine will be safe to resume with some additional guidance, and we can get that vaccine back in the pipeline. So there's where we are. I think we were optimistic, that things were trending in the right direction, but obviously this is a little bump in the road, a little flattening, a little rise in cases. Hopefully we can sort of get things back on track heading into the spring, early summer, so that we can have a summer that more closely resembles the summer that we want. So everybody hopefully can remember to just take that little bit of extra care when they're out socially, to try to limit the spread of the virus while we try to get up to the herd immunity, which we still have a little bit of ways to go before that. Anyone have questions on COVID before I go on to the irrigation or the geothermal well?
Yes. In regard to the variants, do either you or Margaret know how the state determines which, do they take a certain number of samples from different towns and then do the genetic testing?
Statewide, there's a random sampling of about 1.4 to 1.5%. Beyond, and that's just random sampling. Beyond that, they recognize that variants are pretty much, the predominant strains right now, particularly the UK strain, the B117. Beyond that, we do contact the Department of Public Health under certain circumstances. If somebody tests positive within 90 days of a previous test, and if they are considered fully vaccinated. So beyond 2 weeks with Pfizer, Moderna, or beyond 2 weeks with one J&J, if they've recently traveled to a highly endemic area, one of the at-risk countries, if you will, or if there's anything unusual, there is a big cluster of cases that have become positive, or there are a big cluster of people that are highly symptomatic, seems like COVID, but nobody is testing positive. So those are the circumstances in my discussions with the Department of Public Health, where they will add on and specifically try to track down a sample to be traced. Not every sample has enough viral load on it, so they can't just do it automatically. And a lot of the labs don't keep the samples very long. So they're, biohazardous material, and they've got a lot of samples. So beyond a day or two, they're often thrown away. So it's a bit of a race against time when we do find results to try to track it down. But that's the quick summary. Jared, I don't know if you have any additional things to add.
No, that's great. Thank you.
Thank you.
Carol or Shelley, any other COVID related questions at the moment?
No.
Okay, the last topic I have in my report is to ask to invite the folks over at the Brigham into our May meeting. They would like to present to the board their plan to do a solar panel array and a geothermal well on site over at their building at University Station, where they are expanding or in the process of getting permission to expand to the second or third phase of their project there. So they have engaged with the town previously about a geothermal loop well, which would help them with their energy efficiency and be more eco-friendly. The issue with that is that it lies inside of the zone where our major wellheads for our drinking water are present. So there are some inherent risks to any type of boring or drilling in that highly sensitive area. So the town and the Dedham Westwood Water District have been in discussions with them about this issue, and they very much would like to come and present their plan and their thoughts to the board for you all to consider while we work through the technological issues and ultimately come with a recommendation between ourselves and the Dedham Westwood Water District. So with your permission, I will extend an invitation for them to come to the next meeting and to give you a little brief overview of the technology involved in installing a geothermal well.
Jared, I have a question.
Sure.
I read through the 20 pages or so of the information that you sent, and it's a lot of responsibility for the Board of Health. It seems like that's where the decision lies, although I know that obviously we have to, we'll listen to people's recommendations, but does the town intend to get a consultant to help with the decision? Because there are just so many complicated issues. It's kind of mind-boggling.
Right. So the town is utilizing the Dedham Westwood Water District's consultant. So it's Weston and Sampson, I believe. They are conducting an analysis at this point under the direction of the water district, since they have, sort of primary oversight over the drinking water safety. We do regulate any of the wells that are in our in our towns, but that in this particular case, we are partnering with the water district because those wellheads for the drinking water are, under their control. So, there will be a report, for us to read and digest and discuss before ultimately we make a recommendation, either way. But obviously, we're sort of just getting that ball rolling at this point. We had 2 meetings on it, I think, in February, March, and they had asked to come, and it would be a good chance maybe, for questions. You could ask them directly. about the prospects of and the feasibility of doing a project, which normally we would look at favorably, but in this particular instance, given the sensitivity of it, we may feel differently in terms of, but I mean, that's my opinion. I'm not going to formulate my full opinion until I can read the report, but at first blush, I was a little bit taken aback by the prospect of adding any type of human caused disturbance to that area.
Do we know, is the Dedham Westwood Water District paying for the consultant?
As far as I know, they are. I believe this is under, like, they're already have an agreement.
Okay.
I haven't gotten anything back from Eileen, their director, in terms of their cost structure or any type of sharing on that yet. If they would like for us to contribute to the project analysis, obviously that's something we could discuss with land, with Nora and with the select board and Chris Coleman. But as of right now, I haven't been approached with any type of request for funds.
I just want to make sure that it's being independently paid for. I was somehow got involved in the Brigham's project to get people to weigh in with DPH, and they're pretty, I don't want to say heavy-handed, but they're really, they come at you with calls and emails because they want the neighbors and the residents to say that they want this building. So I just want to make sure that they're not paying for the consultants, because I agree with you. It's a really big, serious decision. So I just want to make sure that we're getting good advice.
Yeah, this is a consultant that the Westwood Water District uses and has used and has opined on other projects, here in town as well. So I believe that their analysis is going to be impartial and fair.
Right.
We'll have to reserve judgment till we read it, but that's every indication.
No, I feel better knowing that. Thank you.
Okay.
So Jared, what you're saying is, and thanks Shelley for that, there's more steps to this,
Yes.
We'll hear a presentation and then we have to wait for a consultation report. So there's a bit of time before.
Right. They want to just appear so that they can introduce themselves and their project, with the geothermal, and sort of discuss it and give you the opportunity to ask questions to them directly. I think it'll be a very educational, presentation for all of us. And, geothermal wells are something that are gaining in popularity and as the costs to install them come down, it's something that was relatively underutilized and is becoming a little bit more popular. And just as an example, our school project that is moving along to build the new school is going to have a closed loop geothermal well. The only difference is it's outside of the scope of any environmentally sensitive area. So it's a little bit of a different project, but it is becoming something where larger buildings want to take advantage of the efficiency that they can save on energy and also save on the environment by reducing the greenhouse gases needed to heat and cool. So there's a lot of pros and a lot of cons. Like I said earlier, the location of this is really the issue more than the well itself.
All right, thank you.
Okay, all right.
Did you also mean to speak about town meeting?
I can mention it. Town meeting will be outdoors this year. It'll be on May 3rd? No, 4th. Right, and it'll be a COVID safe event. I will be present. We've had meetings on it before, with all the relevant players. We did do it outdoors last year. We're expecting, I think, a larger turnout, so we're planning for more seats to be on the field. But I feel like, using last year, the sad thing about the pandemic is now, this is the second lap around the block, right? So, with the election and with town meeting, like we've been there, done that. So we have a little bit of experience under our belts. So we will be present and we'll be able to make sure the event goes off in a COVID safe way. And weather permitting, it'll be the one day. And if they have to go over, they have to go over, but that'll be up to the Mr. Moderator, I guess.
I think it might be May 3rd.
3rd.
I think it's
Thank
Monday.
you. Yeah. Honestly, I apologize. I couldn't remember. But those details will be out there from the select board side. So our meeting would be either the 11th or the 18th, our next meeting. So that week after town meeting, we'll not try to meet that week. We'll get together in one of the Tuesdays after. So there won't be I don't believe any issues relative to our department up for discussion at that town meeting.
Okay. Are there any topics that we haven't anticipated that may be coming up? Anyone have anything to say?
All right. So just quickly, summer camps and swimming pools will be coming. We probably, will be able to touch on that at the May meeting, but those are the next renewals that'll be coming out for, for those camps that wish to operate this year. Obviously, there are some COVID restrictions. Last year, we had the recreation department camp and some of the Hale partner camps went off, but many of them decided not to proceed with their camp season just because of the constraints on the busing. The buses, bus regulations have been modified, making bus transportation a little bit more practical. So we will wait and see how many of those camps decide this year that they would like to participate, and we will work with those. We do have training in the next 2 weeks with the state to kind of go over those those things. So more to come on that. But other than that, I think that's all that we have going on.
All right.
And Erica, I don't know if there's anyone in the queue that has anything they'd like to say.
There's someone in the attendees, but I don't see any hands up or Q&As.
Okay.
You want to wait a few minutes for that, or?
We can give them a minute if they have a question or would like to address an issue. They're welcome to.
Jared, while we wait, what's the latest on the buses? How are kids sitting on the buses?
I guess it depends on how crowded the bus is. It's still trying to be like every other. It's hard to know for sure how many children, when the schools flip back to fully in person, that were on are continuing with the transportation, or if you had opted out of transportation during the hybrid model, if you have opted in at this point. So that's my my question for them is, how full the buses are. I mean, I've been around town when they've been moving. They're definitely not full capacity. So I think there's plenty of room for social distancing there.
Sure.
As we head into next year and obviously into the summer camp season, that'll be more of a topic for us to discuss. But they're just basically saying however many students you have riding it, let's space them apart, and seating charts should be there so that in case they do need to contact trace, they're available to review. Oh, I do see a question. Okay, no. We do have a guest, so thank you. She does not have a question. Well, thank you for joining us. Nice to have somebody in the audience. All right, so there are no questions from the audience, Roger.
All right. So hearing nothing further, shall we adjourn? Any motion to be made?
I motion that we adjourn.
And I'll second it.
All right, all those in favor signify by saying aye.
I, Carol Ahern.
I, Shelley Reaver.
And I, Roger Christian. I guess the meeting is adjourned.